Good afternoon. Welcome to the University of Vermont Master of Public Health Info session. We're very happy to have you join us today. We're going to go through a few logistics here in just a moment. This session is being recorded. Please do put your questions in the chat box throughout the presentation. We will share the recording with everyone who has RSVP'd. If you're joining us and you're not sure if you RSVP'd, you can email us and we'll put our email address into the chat box to make sure you get that recording. We're going to do brief introductions. We're going to talk about public health today. There is always an unbelievable amount going on in the world of public health, and we're going to dive into a few topics, including the crisis in Ukraine and what that means from a public health perspective. We're going to talk about the University of Vermont Larner College of Medicine Master Public Health Program logistics, deadlines, everything that you might need to know to join the program as well. And again, as you have questions throughout the presentation, please do put them in the chat box. Don't wait till the end. I will pause our presenters as often as needed so that we can get those questions answered. My name is Nicola Willie-Fenton. I work in our Professional and Continuing Distance Education Department. Happy to have you joining us today. And we're so fortunate to have Dr. Jan Carney with us. She leads our public health programs out of the College of Medicine, and she has a deep history in public health as our former commissioner of the Department of Public Health here in Vermont as well. Jan, we're always so happy to have you with us. And also joining us, Vika Pleshakova. She works so closely with our public health students, advising, helping with enrollment questions, and throughout the entire process of your time here at UVM, and oftentimes as an alumni. And we'll talk about some of those services and resources available to current students and alumni as well. Vika, thank you for being with us. So public health, I think, Jan, always we get this question. It's such a broad field. How do you begin to define for people what is public health?
The simple definition, Nicole, thank you, is the science and art of preventing disease and prolonging life. And that's through organized community efforts, and tons of examples of that. Generally, public health focuses on populations and is all about prevention.
And speaking of populations, there's been such a focus on vaccines and new information just coming out in the last couple of days from the CDC on changes to mask guidelines as we are nearing what we hope is some of the restrictions that have been in place for our safety and our community health. Talk to us about what we're seeing here on this screen and kind of the different perspectives of public health we're seeing here.
Sure. This is from the CDC's website, and they use science and evidence about what works to give us credible health information and guidance in this area. And recently they've revised their guidance as the Omicron wave, fortunately, is declining rapidly in just about all parts of the United States, about wearing masks and how we should consider this and being careful and mindful that we want to make sure we don't fill up our hospitals as we open our communities to fewer restrictions, which we all welcome. So there are lots of good guidelines right on the website there, and you can see everything from boosters, and the scientific evidence is compelling about how good those boosters are in protecting us, how you use masks, what kind of masks to use, and self-testing at home, how we can best use that to protect ourselves and our families.
We think about just how far we've come in the last 2 years. It's really been fascinating to watch the guidance from the CDC and the WHO as well. So speaking of another crisis that is happening as we speak, the war that's happening in Ukraine, and in the sheer volume of people that are leaving the country right now. You know, we've seen reports of close to 700,000. I think the World Health Organization is anticipating it'll be in the millions. You know, Jan, you and I were talking about this as well, as war as a public health crisis. What are just some thoughts on that from your perspective?
When we see this on the national media, the emphasis is often on the conflict. And in public health, we have to look at this as a huge emergency, and one that we have to deal with now, and one it's not going to go away anytime soon. What do we mean by that? First of all, our largest organizations nationally, the American Public Health Association, has rightfully condemned the invasion of Ukraine and the impact on all of the people there. If you look at things like all those people leaving. What happens? They pick up, they take whatever they can carry with them, their families, children. Sometimes they leave a father behind or part of their families behind, and they leave. And where do they go? That's the first question. Where do they sleep? How many nights do they go without sleeping? Many of them have sought shelter on the subways against some of the bombings, for example. What about food and water and safety and access to medications or health care if they're sick? All these become immediate emergency considerations for everyone doing their best to provide humanitarian help, and that's rolling out now, and I'm so happy to see that. And then also that immediate stress, and over the long term, this is really traumatic on families. They've lost their social roots, they've left their homes, they have no access to all the social supports and their usual health care. So for a variety of reasons, this is indeed a public health crisis. Bringing it back to COVID for a minute, in this era of intense progress, particularly with vaccines, only about 35% or fewer of Ukrainians are vaccinated against COVID-19. So wherever they go, I'm hopeful that we include vaccination against COVID-19 as part of that humanitarian effort to help people there.
Yeah, absolutely. It's so much more complex than just what we're seeing, I think, on the news and reading. So thank you for that perspective as well. And again, back to what you said in the beginning, the field of public health touches everything in our lives, in our community, in our world. And here's another example of climate change as well.
Yeah, climate change, a huge issue. And you can look at the chart. This is from CDC and all the different ways that climate change specifically impacts human health, from the air pollution to the changes in the vectors that might relate to changes in infectious diseases that we might be exposed to, allergens, the quality of our water, food supply, depending on exactly what is happening. Environmental degradation, extreme heat can cause illness and deaths, particularly in people who are very old and very young, and the impacts of severe weather, and we've seen all those. So this is something that's been a huge challenge. Back in the 70s, we had the Great Environmental Awakening, and that resulted in collaboration about laws and policies and real progress in terms of protecting the environment and human health related to the environment. I'm hopeful that we'll see more of that soon.
And healthcare, just you made reference to access to services that many Ukrainians just won't have within, overnight. Their whole system has been uprooted as well. And so this continues to be an issue overseas, but many times people don't have access to healthcare as well.
Right, exactly. When people think of health, they think first of healthcare. That's one component of our overall healthcare and public health system. The United States as a whole, we still haven't figured out, despite the progress we've made in ensuring millions more people under the Affordable Care Act or Obamacare, we still don't have healthcare insurance for everyone in our country, and we're the only high-income country in which that's the case. And we also don't rank highly as other countries and our peer countries on life expectancy and many health outcomes. So it's really important to remedy that access to health care in all parts of our country, as well as making better connections with all of our public health and initiatives to improve people's living conditions, things, those social determinants of health that are so important to people's health.
And social factors that you just started to mention,
right.
too.
And here they are. This is from the Kaiser Family Foundation. And what they do is they break it down into some categories that are actionable. Economic stability, whether or not people have a job, is really important to health. Neighborhood and physical environment. Do you have affordable housing? Do you have transportation to healthcare, to your work, to where you need to go? Education, more literacy, higher levels of education tend to protect people against many health conditions. Enough food and high quality food. our social context and the integrity of our communities. Those social supports are so very important for people of all ages. And then our healthcare system we've mentioned. Unfortunately, in our country, we do have a long history of racism and discrimination that overlays all of these things and that we must deal with in order to fully achieve health equity in our country.
And continuing here, looks like even more perspective on, back to your original point, public health is everything. It's everywhere in our communities and our world. And I think this slide just continues to illustrate that.
Yeah, health on a global scale is paramount. And we just talked about social factors. If you look at the Sustainable Development Goals from the World Health Organization, you can see how the social factors are really intertwined with when we talk about.
And back to your original point when you were referencing CDC, it's based on the science, and we followed the science in public health related to COVID, and it has been wonderful to see so many Americans understanding that public health is based in science, and that's really what is the beauty of public health.
We hear a lot of opinions out there, and when we go back and we look at that, what is the evidence for that? And even more importantly, how do we communicate that and have conversations with people and communities such that not only do they understand that they want to act on that. And that's probably one of the biggest challenges of public health right now.
Absolutely. Well, we're going to get into the program here in just a moment. And one of the things that is amazing about our program is it started as an online master program. It wasn't transitioned in as many we've seen over the last couple of years. It was built intentionally to be a very flexible, robust online program at the University of Vermont out of the College of Medicine. And that has really worked well for many, many students. And Vika will share with us a little bit some different careers and different perspectives that students come to our program from. But I wanted to share this brief video. This is now an alumni of our program, Isabel, and she really talks in this video about what it is like to be an online student in our Master of Public Health, and what that support is like and what it feels like in the collaboration. So I think it's an important piece to set the tone as we talk more about the program. So we're going to turn off our videos real quick here. Stay with us. We're going to come right back after we hear from Isabel, and we'll continue the conversation.
UVM does a lot more to consider the fact that the experiences of their public health students will be different. The field of public health that I'm most interested in is global health, and the way I got there was from my undergraduate studies in microbiology and immunology. One thing that attracted me to the online MPH program is the fact that I'm so independent. My schedule is pretty sporadic, so just knowing that I would have the flexibility to plan around that was great. I actually find that I have a better relationship with my professors at UVM, who are all online, than I ever had with any professors in my undergrad experience. The program does a really good job to make up for the non-traditional social aspects of learning. So there's a lot of discussion board and, using Microsoft Teams and Zoom and interacting with other students. So I think that's really unique. I think the school has done a great job adapting to those needs during a pandemic. It takes discipline, but I think it's so rewarding to be able to have the independence and the flexibility to live your life and also go to school and be a master's student. Here they really care about their students, and I think especially coming from a public health discipline, in pandemic times especially, our professors have been extremely caring about what's going on in our lives, extremely accommodating, and letting us know too that, we're human beings as well. We're also struggling. The stress is not lost on us. We're here for you as your professors, but moreover, we're here for you as your colleagues and as your teammates, and we're here to support you and ensure your success.
Welcome back. I think it's important to hear is this perspective on that flexibility, because so many times our students in our graduate program are working and advancing their career. So having that flexibility in an online program, I know, was paramount to building it. And so, Dr. Carney, let's back up a little bit. Let's talk about the program. This was your vision along with your team from the beginning. Walk us through, what is UVM's Master Public Health Program?
UVM's Master Public Health Program is a nationally accredited program by the Council on Education for Public Health. And as such, it has requirements that of a certain length and all the disciplines that are included in that to make sure that everyone graduating from the program has the strongest possible foundation in public health. So these include things like environmental health sciences, biostatistics, epidemiology, social and behavioral sciences, health policy and management, which is now called Health Services Administration. That's a part of public health that really connects to healthcare. And then you can't put everything into those categories, and you can look in the center of the diagram, everything that is sort of interdisciplinary and cross-cutting. We have a real focus on diversity, equity, inclusion now as we strive for health equity for everyone. Leadership, professionalism, a lot on communication, as I mentioned, really, really important. Our program's 100% online. It's interdisciplinary. We have connections among many, many different sciences. It's 42 credits, and you can see what are the required credits, and then you have electives and a culminating capstone project.
And this is really, I think, one of the things that sets our program apart is your focus in those 3 areas of excellence. Can you describe that for us?
Yes, we have, many of our faculty are expert in these different disciplines, and quantitative public health sciences is epidemiology and biostatistics. We live in a world where these are skills that really help our graduates be successful in a broad range of public health careers. Global and environmental health. We've just heard some examples of how important that is in our world today. We really live in a global society. And health policy, leadership, and advocacy. What is it about health policy, or sometimes it's health laws and health care, but also that leadership and advocacy that is really transformative in making progress in many areas of public health?
And I do want to encourage anyone who has any questions as we continue the presentation today. We'd love to hear from you. So please do put some questions into the chat box, and we will get to those as soon as we see them. You mentioned electives, and I think this list continues to grow. Do you want to just touch on how electives work in the program?
Yes, we have everyone in the program gets 3 electives, 9 credits. And students can make choices, and Vika helps them with those choices of, do you want to try a little bit of everything? Things that you've just never heard of before or would like to learn more about? Or do you really want to focus, for example, take all of your electives in the area of environment and global health, or one of the other areas of excellence? And that is really absolutely every student's choice.
Yeah, again, that flexibility that we provide not only in the modality in terms of being able to work on the class in an online and on your time perspective, but also in some of the choices that you can make. So Vika, we'd love to start hearing from you as well. Thank you for sitting back there and being with us. Because it's really some of the components we've been talking about. Some of the other components of our program are some of the things we list here is your guidance, as Jan mentioned, support that we have for students throughout the program and afterwards, and then just really keeping an eye on what's happening in terms of trends and really what's going on in the world of public health. Why don't you walk us through
Sure.
what we're seeing
So we
here
help students from the point of their just inquiring about the program through the point of graduation. So if you're interested, if any of you are interested in meeting with me and talking one-on-one in more detail about the program, I will be happy to do that as well. And you can reach out via email that was provided in the chat box. So from the point of talking to prospective students on what it takes to apply to the program, then leading through the program, helping them pick the courses, identifying the length that you wish to take in the program, which can be up to 5 years, and then helping alums as they approach their graduation date, helping them with their LinkedIn profiles, personal statements, or resumes, for example. helping them connect to our existing alums out there in the field. We have an extensive LinkedIn group with close to 200 members now. And so if you're interested in the specific field of public health, we will be able to connect you to an alum who is working in that specific field, or even in the geographical area that you might be interested in. And as you mentioned, Nicole, there are emerging trends in MPH that we also keep our fingers on, and we would advise students to take specific electives in the area that they might be interested in. And also, as public health is changing every day, we do come up with new elective courses on a regular basis that might be of interest to students as well. And since it's an online program, all advising is done via Zoom, Microsoft Teams, or via phone.
Great. And they talk with you a lot. I know how active you are with our students. And we made this reference a little bit ago in terms of the different types of majors. You know, there's some recent grads that come into the program. There's accelerated MPH program here for UVM for students who are in their junior year, you know, that are thinking of also adding a master's. And besides undergrads or recent grads, there's a wide variety of roles that people come from into public health. Could you just maybe touch on some of the different positions?
Sure. So we see the students come from all over the place. They're from different backgrounds, and you can be a recent undergraduate student or even a senior who is doing accelerated MPH through a practicing physician who would like to complement their existing position in the medical field by taking courses and getting their MPH. It's really great to have all of those perspectives in our program, and the diversity of students that we have, they bring a lot to the classroom. And since the public health field is so diverse, and we being the generalist program, we usually say, like, what can't you do with this once you graduate with MPH? And here is just a sample of the professions that our students get into. So it's depending on your interest and the area of excellence that you choose to go into once you graduate.
It's really diverse, and we see, I love talking to the students and hearing some of their paths to public health. So how do you get in? The next two slides are about what is required in the process.
Sure, the process is fairly simple. We do not require any standardized tests to be accepted in our program. You do have to have a bachelor's degree with a 3.0 GPA or higher. We do ask that you have a basic understanding of science and have a college level math course, algebra or statistics. And the reason we ask for that is because you will be taking some highly quantitative courses like biostatistics and epidemiology, and we want to make sure that you will be successful in those courses. But having said that, we look at your application holistically, and there are some conditional admissions is possible as well. The application process requires for you to submit your online application through the Graduate College Admissions Office. 3 letters of recommendation, resume, official transcripts, but we will review your application with unofficial transcripts. And the fee is $65 to apply.
We often get the question too, if maybe somebody's coming to get their MPH and they haven't been in school in a little bit, they sometimes will ask, who should I be asking for letters of reference? How do you
it doesn't
respond to that?
necessarily have to come from an academic background. We understand that for some students, it might have been a while since they've graduated. It can be your supervisor, it can be your mentor, it can be your coworker, other than family or a friend, someone who can attest to your work ethics and your commitment to the field of public health.
Great. I know lots of people go, wait a minute, I don't have access to my old professors. And so this slide just outlines fee structure and some key dates. Do you want to just touch on some
So
of
we're
those
currently
pieces for us
accepting
too?
applications for the summer and fall start. You can start the program any time of the year. We have summer, fall, and spring semesters opening. And since we offer our core courses every single semester, you are really flexible in when you can start the program. And then we would identify your time of graduation and how long you would like to spend in the program. Our Vermont resident students pay the regular tuition rate for any Vermont resident for the University of Vermont, but our out-of-state students pay differentiated tuition, which is a lot less than other students pay, which is $1,700 compared to $970 per credit for our out-of-state students. We are accepting students on rolling admission right now. The first day of classes in the first summer session is May 23rd, and the second summer session starts on July 5th. So there's still plenty of time for you to apply if you're interested to start in the summer. And the federal financial aid is available to our students. Unfortunately, we do not provide any scholarships or assistantships from the university at this point for MPH.
What about timing, Vika? If I submit my application soon, how quickly do you end up either getting questions back of things that you might be missing or
Sure. So once we
about
receive
acceptance?
3 letters of recommendation and all of your transcripts, unofficial or official, Dr. Carney will review your application. If we're getting close to the deadline, we will review your application with 2 letters of recommendation, but we would still require 3 of them. Once everything is in place, Dr. Carney reviews your application that same week or could be the next day, and the decision is made fairly quickly. So we usually say that for the students, no later than 2 weeks.
Right. Yeah, that helps. I think thinking of timing of when you might want to make that decision and when you may want to be thinking of starting. And you don't need to find housing on campus, which is a beautiful thing about an online program, because we know that that can be a challenge for some students as well. So thank you both. I wanted to just give a shout out and an opportunity. If there are any additional questions from our folks who have joined us today, we would love to answer those questions. We will share this recording, and we have so many more resources on our public health virtual, our Master Public Health website as well. And I'm going to ask just if Kelly could put that link up in our chat box as well. And we often have videos of other students sharing their perspective. We have lots of videos and stories of faculty and the work that they're doing, in addition to amazing work that our alumni go on to do. And even some stories about how some students have managed coursework on top of family and full-time work, because we know that that is no easy feat. And so sometimes it's good to hear from a former student as to how they structured things so that they were able to get that done. So thank you, Kelly, for putting the website into the chat box as well. So lots more resources there for you as well. And as Vika said, she would love to hear from you if you would like to talk about this, and we can always get questions if you have specific ones over to Dr. Carney as well. So it sounds like we're kind of quiet on our questions. Is there anything else, Jan, that you just wanted to share? I know that we have had no shortage of opportunities for you to talk about public health from media on a global scale as well. It's such a broad field, and it's one you've been in for so long. What gets you excited about continuing to be in public health
I think
and
right
educating
now,
our next
public health has never
practitioners
been
in
more
public health?
important. And I really don't see that changing. And what I love about public health is we can make a difference. And that, you know, when you think you have got something figured out, the world changes. And it's always challenging and important work, and we can help people. So that's pretty much it for me, Nicole. I love being in public health and look forward to working with our next group of new students.
And we're so thankful to have you as well. So it looks like Catherine has a comment here, not much of a question, she says, but thank you so much for the informational session. It's great and answered a lot of questions. You're very welcome. And if you have more questions, we have a pretty robust frequently asked questions section on the website as well. So please do check that out. And again, there's often chat. There's during the workday, most hours, there's live chat. It is a real person on the other end to answer questions that you may have. So please do reach out. That way if that's something you just have a quick question, and or reach out to us and we'd be happy to connect you with Vika to talk more about the program. I think we're in a good spot, right? In and out in a half hour. We wish all of you good health. Thank you, Vika. Thank you, Dr. Carney. And hopefully we'll see many of you in our Master of Public Health program at University of Vermont. Have a great afternoon.